All right, y'all, I'm gonna let everyone file in and then we'll get started at maybe like a minute after. All right, well, we'll let people continue to join, but just because we have kind of a packed agenda today, I'll go ahead and jump in. So welcome. Today's webinar, we'll be discussing the highlights from the MSD Solutions Lab most recent paper on the intersection of DE&I and MSDs with a focus on ways to ensure equitable outcomes for all workers. And this research was supported by Amazon, and its contents and results reflect the author's contributions and are solely our responsibility and do not necessarily represent the views of Amazon. And so, like I mentioned, we do have a packed agenda today, so I'll just briefly walk us through what we'll be covering. But first, we'll introduce ourselves, the lab's mission, and the purpose of this most recent project. Then Ram and I will discuss work systems and cultivating inclusive organizational practices. We'll move into talking about equitable solutions that are aligned to the hierarchy of controls. And lastly, we'll discuss what is coming up for the lab and ways to get involved with us moving forward. And we do plan for there to be time at the end for some Q&A. So as questions come up as we're talking, feel free to drop those in the Q&A feature, and we'll try to get to those at the end. And this presentation is being recorded and it will be available on our website in the coming weeks. And just as a caveat, if we don't get to all of your questions, live today, we'll be able to follow up with you via email. So, all right, a bit about us. I am Dr. Paige DeBaylo. I am the research manager for the MSD Solutions Lab. My background is in industrial organizational psychology, and it's been super exciting to apply my training in that area to the world of ergonomics and MSD prevention. And we're also joined today by Ram from the MSD Solutions Lab. So go ahead and introduce yourself, Ram.
Thanks, Paige. Hello, everyone. My name is Ram Mekala, and I'm part of the MSD Solutions Lab, and I'm a consultant for this particular program. And my background is in ergonomics. Thank you.
All right, thank you, Ram. And so just quickly, kind of to set some groundwork for us, what are MSDs and how are we addressing them? So MSDs, for those of us who might not be as familiar, are injuries or disorders of the muscles, nerves, tendons, joints, cartilage, and spinal discs. And specifically work-related MSDs, which are the focus of the lab, are conditions in which the work environments or the work that folks do contributes to that injury or disorder. And so these are one of the biggest health and safety challenges facing employers today and are one of the biggest challenges to operating a successful business. So looking at this challenge a little more closely, U.S. private businesses report spending more than $1 billion per week on workplace injuries. And in 2021, businesses lost almost $18 billion in direct costs of MSD-related injuries. So therefore, the lab aims to mitigate this challenge through engaging with key stakeholders in MSD prevention, conducting research like the paper we're talking about today, identifying new technology and innovative solutions for MSD risks, and then scaling those results so that all workplaces can benefit. And so now that we've introduced MSDs and kind of just briefly the goals behind the lab, we can introduce our intersecting topic here of diversity, equity, and inclusion. And so just to get us all on the same page, so I know there's a lot of chatter about some of these terms, and so we just wanted to set the definitions that we'll be using throughout the presentation today for you all. So diversity encompasses all human characteristics that make up who we are. So things like your race, ethnicity, gender, sex, SES, national origin, disability status, language, religion. And taking that a step further, equity aims to promote fairness by creating a level playing field for everyone and making sure that everyone has the equal chance to succeed. And also at the same time, recognizing that some groups of individuals may have unearned advantages. And then lastly, inclusion is the practice of creating an environment where everyone is equally valued, respected for their individuality, and where their need for belongingness and their uniqueness is satisfied. And really, I'll just pause here to kind of explain the why behind this report. And that is to explore the facets of DE&I and ergonomics in conjunction with one another, as those two fields really share similar goals. So the goal of ergonomics is to fit the work to the worker, and this really means all workers of all demographic characteristics. So we wanted to explore how organizations can be best equipped to fit their work to their entire workforces, and also kind of discuss a bit about the challenges they run into when they're trying to do that. And so ergonomics and MSD prevention are really human-centered practices. So being inclusive of all workers seems to be clearly embedded within ergonomics, and we wanted to explore that connection further through this work. And so as we step through the findings today, it can be kind of easy to come to the conclusion that maybe there are certain people that are more susceptible to MSDs. And we don't want to let that really be your key takeaway. While that might be relevant, it's on the employer to provide an environment that is equally safe for all workers. So really, the onus here is on the employer. So while personal factors may be relevant to the likelihood of incurring an MSD, it's important to distinguish that personal factors are not themselves the risk factors. MSD risk factors are really due to the workplace not accommodating or providing for all people. So if there's one thing that you do take away from this presentation, let it be this phrase, and that's, if it isn't equitable, it's not ergonomic. And this means that if what you have designed or the way that your work is conducted is not equitable, that means it isn't ergonomic either, as ergonomics ensures that all workers are safeguarded. And so with that, I'm going to let Ram kind of take us away into our first section here about work systems.
Thanks, Paige, for the introduction. So let's look into work systems, because we thought this paper, some of you might have already seen it, we wanted to, it's not a systematic review, it's more of a research insights white paper. So we wanted to look at work systems, how this can be affected by DEI. And then you have these organizational practices. So I'm going to go through this one. So in the work systems, we looked into the work organization, that is in terms of the working hours, the type and pace of work, and then, workplace design. So Paige, do you mind? Yeah, thank you. Workplace design, especially the workspace, and also the PPE and the equipment design, how they play a role in terms of the MSD risk. Next slide, please. So what we did was, the work organization, we have these working hours and the type and pace of work, but we classified all these factors into risk and disparity. Okay, so the risk is, as we know that, shift work, longer hours, part-time employee status, definitely play a role in terms of the MSD risk, especially the longer working hours, either longer working hours in terms of, more than 8 hours per day versus, more than 40 hours a week, and all these factors do play a role in terms of, lack of sleep and lack of recovery, so that, it affects, your everyday life. And, in terms of the research, the night shift nurses had a higher prevalence of MSD symptoms in the lower back and ankle compared to daytime workers. Again, if you're looking in terms of the the type of work they do, the shift work, the longer hours, all these do play a role in terms of, MSD risk factors. So let's look at the disparity. Again, all this is based on the literature which we cited. So we are not putting any citations here, but if you look into the research report, you will find them. So in terms of the disparity, again, the literature says that men tend to work on average longer hours compared to women. And then in terms of women, they participate more in part-time work as compared to men. And then, non-white workers are more likely to be employed in jobs that require working a mix of day and night shifts. It's more of a, they are employed in the jobs that is, more intense as compared to, the white workers. And interestingly, this is workers less than 20 years of age experience less risk on the afternoons and evening shifts compared to workers greater than 20 years of age. I'm not sure whether, maybe they tend to sleep late and then, they're fresh compared to the workers more greater than 20 years of age. But, it seems this is a factor in terms of a risk, with respect to afternoon and evening shifts. Next slide, please. So yeah, so what it says is basically if you're looking at the working hours factor, depending on the shift type of the shift you work or the employment status, workers have a varying likelihood of suffering from an MSD. Next slide, please. So again, if you're looking at the type and pace of work within the work organization as a breakdown, you look at the risk. That is the manual labor and the lower paying jobs are more likely to result in MSDs and pain compared with sedentary and high-paying jobs. typically, high risk industries, that's where you see that. And again, the workload, the time demand, the efforts, and the physical demand during the work does show an increase in MSDs as well. So in disparity, women are more typically employed in industries that are commonly afflicted by MSDs. Again, if you're looking at service industries, hospital, healthcare industries, you see quite a bit of women. You have this high risk towards MSDs. And Latino immigrants and the Black male workers, especially if you're talking about within the U.S., these are all the data from the U.S., are more likely to be employed in dangerous jobs and industries. Okay. And labor-intensive work with high demands and fast paces can be more detrimental to older workers. It's again, it's a debate, but typically as you age, your capabilities definitely go a bit down as compared to the younger workers. So you see that higher the work demand and the faster pace. I'll give you an example of BMW later, but so these are the factors which we have seen in terms of the disparity for the type and pace of work. So just to emphasize, this is based on the Center for American Progress. This is a report from Center for American Progress, which they published in March 2022. If you look at this graph or this figure, it says the composition of the top 10 highest paying occupations by sex, race, and ethnicity. White men, dominate the highest paying occupations. That's if you look at the whole occupations, greater than 50% are typically the white men dominating those occupations as compared to either women or minority. Next one, please. So if you look at the men of color and women and look at the data in terms of the top 10 lowest paying occupations by sex, race, and ethnicity, ethnicity, you see that a lot of hospitality industries, you see quite a bit of presence of white women and other minority. So let's look at the workplace and equipment design. As I said, we classified this work systems into work organization and the workplace and equipment design. Majority, what the literature says, is the lack of diverse workspaces or equipment has the potential to impact employees who have existing physical limitations, and workers who fall outside the targeted 90% of the population. As the ergonomics, we always try to accommodate between the 5th percentile of female to 95th percentile, but can we accommodate in terms of the universal design? So and that's one thing, and universal design says that need to accommodate the full spectrum of the population. But the way I see it, universal design is from the cradle to the grave. It's not my quote, but some design experts say that universal design should be from the cradle to the grave, because as we age within ourselves, we have certain limitations. Can we accommodate? So those are the things we should look into. So that can be a huge risk in terms of how best we can look at the influence of workspace on the MSD risk. In terms of disparity, an employee, for example, who uses a wheelchair, or someone smaller than 5th percentile female, may have a difficulty accessing their workstation or common equipment items. Typically, you have this workspace and the work envelope, whether it's within reach or beyond reach, it's all, can we accommodate, different sets of population at the workspace? So unfortunately, there's a huge disparity still exists. And bottom line is, we need to design any workspace based on the as Paige alluded, human-centric design or the user-centric design. When we are designing something, we should keep the user in mind. And in terms of the PPE and equipment design, there is a inadequate PPE selection and tool design. This has been a huge issue. If you look at the NIOSH now, they have a separate center looking at PPE technology and how it accommodates different anthropometry and all those aspects of it. So there's still a huge risk with respect to MSDs, in the sense maybe you don't have a proper glove and then you are operating it, then that can cumulatively affect your risk to MSDs. And again, if you are, as I said, if you are not accounting for the physical differences, it can lead to ill-fitting, uncomfortable, and cumbersome, oversized, or potentially hazardous, and less effective at keeping the workers safe. Again, if you, for example, as I said, give the glove is a classic example. A lot of people end up doing, there are still some gloves are designed, with respect to the typical male population. So are we accommodating, the women? Are we accommodating the other populations? So that's very important in terms of, when you are looking at MSD risk. This disparity, again, in the construction industry, this has been huge. The women, non-binary, and transgender workers encounter difficulties obtaining a properly fitting PPE. If you look at the CWSC literature too, they say that, yes, still a lot of, equipment we design with respect to male population, and specifically white male population. So what's happening is, when you end up using as a user, then it unfortunately it does affect the outcome in terms of the work performance. Next slide, please. Yeah, and non-white healthcare workers have inadequate access to PPE. This you have seen during COVID as well. It's been a huge issue. So again, we are looking at the risk, but also there is a huge disparity still exists in terms of workplace and equipment design. This is a classic example. Now I know there is a tendency that, hey, surgeons are highly paid, but unfortunately, again, a lot of equipment, surgical instruments are still designed with respect to the male anthropometry. Some of the good studies were done in Mayo Clinic by Dr. Susan Hallebeck and from UCSF, Dr. Amandeep Shargal. They looked into endoscopy instruments, and they looked at that unfortunately still not only these equipment are antique per se, but also they are not, a lot of female surgeons can't even use it because they are not designed based on the anthropometry of the specific population. So, well, Paige, it's up to you now.
Yeah, thanks so much, Ram. Thanks for sharing about some of those risks and disparities that we're seeing. And so I'll talk about some ways that we can foster inclusive organizational practices in the coming slides. And so just at a basic level, to foster an inclusive environment, employees need to feel a sense of belonging. They need to feel like what they're contributing is valued, and they need to feel like they're safe to speak up about concerns that they might have, and that their uniqueness is valued as well. So these are some of the key components to consider when fostering inclusion as well that we'll talk about on the coming slide. So as far as safety culture, this is a buzzy topic as well. This is made up of a lot of things, but some of the things that relate to your safety culture are the policies and procedures that you might have in place, the accessibility and dissemination and communication of information within your organization, and your workers themselves, so your workers' backgrounds. And we'll also touch on psychological safety in this section as well. So having adequate safety policies and procedures in place is part of cultivating one's safety culture. Not having a culture of safety could exclude certain workers from diverse backgrounds, and how your policies and procedures shape your culture is important to be aware of. So looking into some of the associated risks around this, workplaces that lack benefits, that lack disability options or paid sick leave may cause employees to feel insecure about their employment status, and unsafe taking time off if they have suffered an injury or are experiencing pain. Also related, but not being familiar with the policies and procedures, maybe whether that's due to an accessibility issue or a language barrier or being a new hire or being new to the environment, can also lead to unsafe situations. And so these policies and procedural risks can lead to some disparities or widening of already existing disparity as well. So for example, non-white workers in the US reported limited access to healthcare due to lack of health insurance coverage. You can see some of this reflected in this image below from KFF, the American Community Survey, that's highlighting that non-white individuals in the US are less likely to be insured than white individuals. And additionally, MSD risk assessments do not currently account for assessing the risk of individuals who might have physical disabilities, which is a procedural gap that might exist. More research and efforts are needed here to understand how best to tailor MSD assessments and procedures for individuals with different physical abilities. So something more to come. And another risk is language barriers. Language barriers can have, if you have information that might not be properly translated, this could create feelings of exclusion, as well as an inability to understand the guidelines or signage or other policies that are in your organization. And so you can see here on this mock-up an example of signage with poor accessibility at the top, lots of kind of small print, not in multiple languages, and then kind of much more explanatory and inclusive on the bottom, using common safety colors, using much bigger font, being translated into other languages. So just something to keep in mind when making sure that the information that you have within your workplace is accessible to all folks. And really the disparity here is that using highly technical language or not having translation can make it more difficult for all workers to access your materials. And related to this, where language as a barrier comes in again, is that if you're seeking care or treatment for your pain and injuries, there's been some research that shows that language barriers can again prevent workers from receiving the proper care or treatment that they might need. So just something to be aware of as an employer if you do have folks within your organization who might speak a different language than the predominantly spoken language in your workplace. And while not modifiable by the workplace, it's important to understand how your workers and their individual cultural backgrounds could influence their approach to suffering from work-related injury as well. So some individuals may be less likely to seek treatment or even raise concerns about their pain, and may have generally a different approach to healing. This could impact MSD recovery and treatment, and again, is important to be aware of and sensitive to as an employer. So workers who have high levels of a willingness to work, despite the circumstances, and identifying whether cultural or not as a hard worker, and having a tendency to avoid evoking shame and having a need to get along with others may lead workers to accept dangerous working conditions. They might not be as likely to speak up about their safety concerns, and they might not be as likely to report their pain or injury. And so some of these aspects covered here could be due to their cultural background. So identifying as a hard worker, not wanting to evoke shame. So again, just something to be aware of your individual workforce and how they might present when communicating with you about their pain or injuries, and some sensitivities to just be aware of. And related, some workers may rely on alternative therapies for their pain or injury, which could ultimately dissuade them from seeking the professional medical advice that they might need. So again, an important factor to be aware of for your workforce. And so regarding psychological safety, the risk is that without psychological safety, workers may not feel safe speaking up about hazards and risks. And so I know this has been talked about, but it relates to psychological safety as well. So I wanted to kind of drive that point home here. And we see this feeling of fear of speaking up disproportionately impact certain workers. So for example, low-wage workers and workers of color report more trepidation about reporting their injuries at work. And so related to this, Black and Hispanic workers report the most unease about reporting unsafe working conditions when compared to white workers. And some data also show that women may be more comfortable than men in reporting work-related MSDs and voicing their pain. So again, just some disparities to be aware of within your workforce, understanding who might be more likely to report, and then finding ways to reach some of those individuals within your workplace that you think might be a little bit more wary of reporting, to make sure that we have accurate data so that we can really do something about some of the potential hazards within the workplace. All right, and so Ram, I will pass it back over to you to talk about some of the equitable solutions that folks could implement within their organizations.
Thank you, Paige. Sorry, I've been sweating. It's so hot here. So can we go into the next slide, please, Paige? So, what we did was our report, our literature search, what we did was we did our best to, try to put these solutions in terms of hierarchy of controls, NIOSH hierarchy of controls. So you have elimination, substitution, engineering, administrative, and PPE. So in terms of the elimination, as you know, that's the best way to, to eliminate that, I mean, to be free from the injury or any risk. So be mindful of jobs that demand high exertions, awkward or sustained postures at a fast pace, and eliminate them when able. So basically, elimination is the first, the step. But unfortunately, not all jobs can be eliminated. So so then what we do is we go into the substitution side of it. Again, it's not that you all don't know, but it's just so it's an safer alternative to a working condition or a process that would otherwise contribute to a worker injury or illness. So basically, using the workplace design that is adaptable. Okay, that can be one way to do it. And again, strive for universal design in terms of yes, you can accommodate. You might not be able to accommodate for every population, but at least try to find ways so that can be Of course, this can be classified in engineering control as well, but we just put this as part of a substitution. And again, look into job accommodation network or ADA in terms of ergonomic accommodations for all the employees, with medical conditions and disabilities as well. So if you go into engineering, again, redesigning the work to minimize exposure to hazards. A lot of people talk about prevention through design, engineering out the hazards. So, again, when you are doing that, involve employees from the diverse backgrounds in the design and evaluation of engineering controls. Again, I'll give you a classic example with a BMW in the end, but so provide assistive devices that are adjustable and can adapt to worker needs. Again, classic example is sit-to-stand workstations. A lot of people have this at their workplace, to accommodate different, the heights of workers, and consider different needs for employees with sensory and medical conditions. Again, you're trying to accommodate to the conditions of the worker. And ensure technology, tools and the interfaces are designed with accessibility features. We talk about DEI, but whether they are accessible or not, that is very important. So I still feel DEI and accessibility. That's how that's how I look into, because yes, we can have all these DEI policies, but are they accessible or not? That's one thing, at least in the administrative controls we should look into. So incorporate designs that respect different cultural norms and practices. This one thing we put that in one of the examples is, yes, you can have a machine guarding, but if we have some of the workers who have they have a certain clothing, religious practices, which when they are at work, that can hinder and that can be a risk to work. So just again, incorporate designs that respect the different cultural norms and practices. This is a wonderful example, from our infographic where you're trying to accommodate different heights of the workers. This is one of the classic meat packing industries example. Again, we put a lot of items or the ideas in terms of in our report, but we'll just give a few because of the time. So in terms of the administrative, you're looking at the policies or procedures. Allow again, frequent rest breaks. They're definitely a very important one, and ensure pay equity. Equity is very important. That's one of the things. Yes, it doesn't matter what kind of, but if the work, that particular work, you need to have certain, pay equity. And consider job sharing or part-time work for employees at higher risk. That's older workers. Again, this is a very good way. When I when I talk about this BMW, they looked at this kind of a one of the strategies as well. So, but again, we are looking at different ways to accommodate a specific population. Okay. Again, policies and procedures are very important in terms of coming out with certain guidelines. Analyze and ensure proper translation of current ergonomic, safety, and health policies and trainings, and update regularly. Again, this is very important. When in my previous job, when I was in the healthcare, during the time COVID happened, and we, as ergonomics experts, we ended up writing a remote ergo policy. Again, make sure that we can accommodate not only the different situations but also different set of populations. Again, those policies and procedures to reflect that. And conduct user surveys or focus groups, again, to understand ergonomic challenges. Again, participatory approach is always a crucial one in terms of equitable designs. And promote diverse representation and a participatory approach to ergonomics. So again, I'm stressing that fact that when you are trying to develop something, be inclusive of all the stakeholders. So this is one of my favorite example. Although it was in 2010, this was published at Harvard Business Review. Did this on how BMW is diffusing the demographic time bomb. And so the problem was the average age of the plant's workers was expected to rise from 39 to 47 by 2017. So this was a study started in 2007. Okay, so the problem was that they are the age, the plant workers aging. They looked at how does it affect the age, rather how does the productivity affected by these aging workers. So they were worrying about productivity because older workers tend to call in sick for longer periods, and also in general they work harder to maintain their output. So that was the problem BMW was facing in Germany. Okay, so what did they do? So what they did was very interesting. They chose one of the plant's production lines for a pilot project. It was a heavy production line, in terms of output. So they took that as a pilot. Okay, and so there are two line foremen. They are staffed with a year 2017 mix of workers. That is, workers with an average age of 47. So they had this mix of workers, and they worked with the people not only on the assembly line, supported by senior managers and technical experts to develop productive improving changes. So they had certain framework. So they wanted to work with everyone, to come out with a proper plan to accommodate these aging workers, so that the productivity doesn't affect. Next slide, please. So this is on the left side, you see that a pilot production line in 2007, the average age is 39 versus, in the production line, average age in 2017 is 47. So what they wanted to do is they wanted to accommodate the aging workers as well. So unfortunately, when they started having these conversations, there was a huge, resistance from the younger workers. They started making fun. They're saying that it's a pensioners line, basically. And workers felt that it's a top-down approach because, no choice but to adapt. So you're basically dumping, these aging workers into my group. My productivity is going to go down. So that was the perception. So what they did was, so again, they used the participatory approach. They had they partnered with the plant's workers council, and that's the word they use in Germany, I believe. So, and they appeal to the workers' pride. That is, we need your experience and skills to pull this off. So it's important for the future of this plant. Our jobs are at stake. So they really got a buy-in from the workers. Okay. And so they persuaded 20 workers already on the line, on that line to stay, and recruited 22 more with the promise that, they could return to their old position after 1 year. So this was a 1-year project. Okay. So this. And so in October 2007, they staffed with a mix of workers reflecting the plant's projected 2017 demographic composition. So that's what you see on the left side. Okay, next slide, please. So, it's a classic. The reason I am emphasizing this example is they not only looked at the substitution aspects of and also engineering controls, they also used administrative controls. So what the solution was redesigning the production lines. So that's what they did. And so both direct and indirect investment in the 2017 line project they call that particular pilot project or the pilot line production line as the 2017 line project was around 40,000 euros. Okay, and the result was the changes, whatever they made there, they made around 70 changes in that production line. They increased the productivity by 7% in 1 year. So bringing the line, that production line, on par with the lines in which workers were on average were younger. And so after the productivity increase, 4 workers were reassigned to other lines. But interestingly, no one wanted to leave that particular production line. So they really enjoyed how that work has been set up or how work has been done in terms of not only taking their input, but also it is, again, it's a bottom line approach, instead of the top down approach. And so by June 2009, their absenteeism dropped to 2%, below the whole plant average, that particular production line. So, bottom line is with respect to that, what the message was that, if not only that taking the input from the management encouraged, and the production line foremen got involved, and the workers had a say in terms of what they can do with respect to so they took input from the workers, how best they can perform the work and how best they can increase the productivity. So it's a classic example of participatory approach. So again, what it says is they call it as a distributed organizational problem solving. That is, plants top management raise that issue because they are worried about the productivity. They're worried about the competition. So the production managers ran that particular experiment, and the line workers created the solution. They created 70 solutions. So that's a classic example of how we can include diverse population in coming out with the equitable solution. And the last resort, is of course, as you know that if everything fails, then we end up with a PPE. So in terms of the PPE, routinely check with with employees if which PPE is needed. So again, you need to look into the different body types, abilities, and cultural preferences. This is, I think, if you come to the human factors and ergonomics conferences, you're seeing quite a bit of this, designing PPE to accommodate different needs. So it's growing now. And the source, the PPE vendors with the diverse offerings and sizes. Again, this is a classic example has been unfortunate COVID time. People have looked into not only the, different sizes of the masks, but, the transparent masks as well, because especially for surgeons, if they are communicating, you can, with the transparent mask, you can, at least communicate with the fellow surgeons. Again, offer on-site PPE vendor sourcing, fitting. Again, the fit of the PPE is very important, as you know. So again, get the feedback from the employees because they are the front line and they are the ones who uses it. So getting the feedback from them is the best way to go. And the source technology that fits your workplace and your workforce. Again, go for the technology which suits your your workers' jobs. And so I want to end with this, at least, before I pass it on to Paige, is that, NIOSH developed this national strategy for equitable PPE production for U.S. workers. Dr. Patrick Dempsey, a brilliant scientist, who, he presented this at the last year Human Factors and Ergonomics conference. They suggested 5 constructs that affect equitable PPE production. So the first one is use. So it refers to the user being protected from the intended hazards while not creating other risks, which is very important, right? If you are trying to use something, I hope it doesn't create, when you are trying to, put a mask, a lot of people had some breathing issues and stuff. So there is a proper way to do it. So I hope it doesn't create other risks. That's one of the things to look at it. And the next one is acceptability. It refers to PPE designs that are sensitive to social, cultural, comfort, and physiological considerations. So the PPE is acceptable to the user. Okay. And the next one is accessibility, to be located at the point of use at the time it is needed. You can't put this PPE far away that you can't even you don't even have time to get to it. So that accessibility is very important. Okay. Availability, it refers to being able to procure PPE without undue burden or a challenge. So if you look at the example which provided here, you're looking at not only the appropriate size being manufactured, but also the appropriate size being available for purchase through wholesale or retail channels. Again, COVID is a very good example for that. And the last one is knowledge. It refers to the factors that impact the correct selection of the PPE, use of PPE, and maintenance of the PPE. Paige, it's all yours.
Yeah, thanks, Ram. And thanks for covering those examples. And I think, the BMW example, I do think really hits on a lot of the things we were talking about and ensuring equitability across your workforce and thinking of ways to involve your workers in the redesign of work as needed to fit their needs. So thanks for taking us through those solutions, Ram. And like you mentioned, there are many more of those solutions that, we didn't want to bog you down with too many today, but that are provided in the paper. And I'll have a QR link for that paper for you guys here in a second. But just some main takeaways that we wanted to highlight before we end our time and dive into some of the Q&A. But just that diversity, equity, and inclusion are vital in the prevention of workplace MSDs. Let's see. Also, work environments and workers vary widely, and workplace factors may disproportionately affect workers based on their individual characteristics. Proper ergonomic interventions and the implementation of equitable solutions should account for these diverse workforces and workplaces. And employers should consider the unique needs of their diverse workforces to create inclusive environments with equitable solutions. So just some kind of key takeaways from the paper here. And like I mentioned, this is kind of a recap of a paper that we have already published, and so it's available on our website. And so you can read that full paper here if you're interested in scanning the QR code. That'll take you in to provide a little bit of information and then be able to download the paper. And as Ram mentioned, we talked about a lot of risks and disparities today, and those are, backed by references and resources. And so if you're interested in learning some more about the studies that were referenced, those would be in the paper as well. But all right, so just to kind of end our time here before we dive into Q&A, we just want to talk a little bit about future plans for the lab and what's next. So if you haven't already, I recommend familiarizing yourself with some of our resources from the MSD Solutions Lab. So we have many free resources regarding developing policies and procedures, kind of like we talked about today, around MSD prevention, tips on creating cultures of safety, and also things like learning about emerging technologies for MSD prevention, and lots more. So case studies, infographics, kind of different resources to suit, lots of different workplaces and work types. We also wanted to highlight a couple resources that are coming up soon that you can be on the lookout for. So we'll have a flow chart regarding steps involved for MSD medical management at work. We'll have a paper coming out soon about the importance of accounting for non-physical risk factors in your workplace, which kind of takes a more holistic approach to MSD prevention by focusing on risk factors other than just physical risk factors. And we'll also be publishing the MSD Solutions Index report, which will summarize responses from MSD pledgees, which we'll talk about here in a second, their responses to the MSD Solutions Index, and provide kind of a current state of some of the organization's MSD prevention programs. So those are all coming up, hopefully before the end of the calendar year. And we also wanted to bring to your attention that in September, we are hosting NSC's annual flagship event, so NSC Congress and Expo, which will be in Orlando, Florida this year. And again, you can feel free to scan this QR code to learn more about Congress and get yourself or your team registered. Congress offers a wide variety of educational sessions with a large and diverse expo hall to explore possible solutions to your workplace safety issues. And the MSD Solutions Lab will be featured prominently there through a specific technology pavilion that's dedicated to MSD technology solutions. And lastly, the MSD Pledge. And so this is kind of a cornerstone aspect of the MSD Solutions Lab. And so the MSD Pledge is a movement for workplaces interested in joining a community of safety-focused organizations who are really on a mission to reduce and mitigate MSDs in their workplaces. MSD pledgees get access to free and exclusive benchmarking events with other organizations. They get exclusive grant opportunities. They get a third-party developed assessment of their MSD prevention initiatives, and other exclusive offerings for pledgees, like the opportunity to contribute to case studies or attend office hours with members of the MSD Solutions Lab team. So if your organization is not already an MSD Pledge member, you can scan this QR code here and learn a little bit more about the MSD Pledge. And really just thank you everyone for joining us today. I think we've saved about 15 minutes for questions. And I see that a couple have come through. But if you don't want to answer or ask your question today in the Q&A, we're always available via email for questions as well. And so that is here on the screen. All right, let's see. Let me pull up the Q&A and see where we're at. And yes, I do see a question that came in about how was DE&I defined for the report, and that this can mean different things to different people. And I completely agree. We recognize that there's lots of definitions of these types of things. And so let me bring us back up to, and sorry for the scroll fatigue, but we do have some definitions that we used for diversity, equity, and inclusion here. Let me get back to those. We introduced them at the beginning. And these, again, like Ron mentioned, we didn't include all the references here for the presentation, just to not kind of bog us down on space on slides. But these do come from, reputable resources. So sorry about that. Probably a better way to do this. So here we go. So diversity, equity, inclusion, as was defined in the report. So diversity, just about encompassing all human characteristics that make us who we are. So lots of demographic characteristics there. Equity is a notion that aims to promote fairness by creating a level playing field for all and making sure everyone has an equal chance to succeed by recognizing that some groups of individuals might have unearned advantages. So kind of recognizing some of that disparity that we talked about that might already exist for certain groups. And then inclusion, lastly, is the practice of creating an environment where everyone is equally valued, respected for their individuality, and that their need for belongingness and that their feelings of uniqueness is appreciated and that feeling is satisfied as well. When Ram, I see that you're on mute.
No, I just want to commend Nikki Howard for that question. That's a very much valid question. So, we all have a different ways of thinking in terms of what the definition is. But we have two references we ended up putting in that. So.
Let's see, and I'm seeing another question about where an organization should start if they do not include DE&I in their EHS practices. I think that's a great question. I think the report could be a great start. There are some of those equitable solutions at the end. And I think just kind of a general awareness of some of these disparities that we're seeing and understanding your individual workforce can be a really great starting point. And then, kind of familiarizing yourself with some of those equitable solutions and trying to understand maybe where your organization could do some growing in that area. But Ram, I didn't know if you wanted to add anything to that as well.
Yeah, I mean, that's a good point as well. But, at NSC, we believe that, you can't be safe if you don't feel safe. So that means it requires, a commitment to equitable policy implementation and promoting diversity in our profession. So, again, as Paige said, we got to cultivate your own diverse, inclusive, and equitable work environment. So, that's one of the reasons we developed this particular insights or the white paper, because it's a very, I mean, yes, people, these are not buzzwords per se. We need to definitely, be inclusive in terms of, diverse workforce. So.
And again, I think it's things that we just might not know or be familiar with, that, some of these disparities that fall onto the employer to really try to mitigate. Understanding that it might be different individuals bringing their own personal factors to the table, but as an employer, it's on organizations to figure out ways to kind of circumvent some of those, and make sure that they're providing an equally safe environment for all individuals. So. Let's see, and I'm not seeing anything come through. I did see a question that came through, yes, this is being recorded, and it will be up on our website, hopefully in the coming weeks, as we can get that sorted. All right, if that, there might have been one more. Oh, yes, I can put the QR code up for the paper again too. And I'll stop sharing with you all so that you don't have to watch me go through to get to that again. And here is that QR code. And again, it'll ask just for a little bit of information about you, and then you'll be able to download that full paper. And yeah, if as you're, reading the paper and questions come up, please do reach out. This was a really interesting paper and a really a big learning opportunity, I think, for the team writing this paper, to kind of dive into this area and figure out this intersection a bit more. So we did a lot of learning along the way too, and I hope it's presented in a way that it's helpful for your organization. So. But all right, I think if nothing else rolls through, thank you all for joining today. And we'll go ahead and sign off. And as always, stay safe.
Thank you, Paige. Thank you.
Thanks, Ron. Thanks all.